سلامات خير ان شاء الله.
الله يسلمك دكتور. كان في البيت حس بصداع بعدين ما صار يرد علينا، ما ندري ايش صار فيه.
اول مره تجي الحاله؟
اول مره تجي الحاله.
كيف حالك يا ابوي؟ بخير ان شاء الله.
ما يرد.
تسمعني؟ ايش اسمك انت؟
اسمه عبد الله.
عبد الله ها؟ طيب خير يا عبد الله. خليني افحص النفس عندك، ابغاك تاخذ نفس يا عبد الله.
نفس عبد الله، خذ نفس طويل.
نفس. ما شاء الله نفس. أول مرة تجي الحالة هذه؟
أول مرة.
طيب nurse, please we need CBC, we need the chest X-ray and we need the RT for blood gas sample.
اوكي.
سلامات دكتور، ايش فيه؟ ايش صار عليه؟
والله طلبنا له فحوصات الحين ونشوف النتيجة إن شاء الله. الحين الوضع مستقر يعني إن شاء الله. نشوف النتيجة وبإذن الله ما يصير له خير.
الله يجزاك خير. شكرا لك.
ما تشوف شر يا أبوي.
الله يسلمك. خلاص عبد الله إن شاء الله طيب، بس تجي الفحوص والفحوصات والتحاليل وإن شاء الله يقولون ايش يصير. لا تشيل هم. السلام عليكم. دكتور بشر، عسى صار شيء ان شاء الله.
والله لسه الى الحين ما صار شيء، طلبنا له فحوصات ولازم ننتظر شوي.
ما تقدروا تعطوه اي شيء للحين مسكن ولا اي علاج الحين؟
ما اقدر اسوي له اي شيء، لازم اشوف الفحوصات وبعدين ان شاء الله نقرر.
طيب
خلينا نشوف. هو عبد الله صح؟
ان شاء الله.
عبد الله. طيب هذه الفحوصات كلها طلعت ما شاء الله. طيب خلينا نروح نشوف المريض الحين.
طيب.
We take care of average of 25,000 patients per year at King Faisal. And those are very difficult patients with multiple problems. We are able to do that because of all the good work of the allied healthcare that is done behind the scene. And this reminds me with car racing, as the driver gets to get to the podium and be the winner, but all the hard work is done by the people in the ground. Your hands touch the lives of all the patients admitted to King Faisal. We are proud of you. Thank you.
I've worked with allied health professionals from the time I qualified as a nurse. I started my life as a rehabilitation nurse, so I truly value the inputs of other professionals, occupational therapists, speech and language pathologists and physiotherapists. They all come together with physicians and nurses to create a truly special experience for patients. And when I think about some of the professionals I've worked with in the past, I've come to understand that the word AHP doesn't just refer to allied health professionals, but to a very special group of people. I think they're truly amazing healthcare professionals.
This is cyber knife suite, where we do radiosurgery. This is a special system. It's non-invasive, frameless, where we do the surgery using radiation beam. Treatment lasts 20 minutes to half an hour, and it uses multi-directional radiation beams, and we observe the patient and do the imaging every 15 seconds and adjust accordingly. And after the patient is finished, patient is discharged from the hospital, and a wide surgical procedure which used to be the standard practice in the past.
Prosthetic and orthotic department deals with the patients who have amputated limbs, that's one or more of their limbs are missing, or who have acquired musculoskeletal deformities. These patients are then fitted with the external devices that are custom made to their body. All the production is done in-house. We work in close proximity with many departments such as orthopedic department, neurology, and vascular surgeries. Once these people are diagnosed with the deformity, and then they are referred to us to be fitted with the orthotics or with the prosthetics.
King Faisal Specialist Hospital and Research Center Nutrition Service is dedicated to provide and promote optimal nutrition therapy. Our expertise in nutrition, education, and research are striving to provide the highest quality of nutrition for our patients. Our dietitians work closely and collaboratively with most of the medical services, such as oncology, critical care, endocrinology for both adult and pediatric. We have a very unique specialty, which is metabolic nutrition, and we also serve as a center of excellence and a resource for most of the specialties, not only in the kingdom, but around all the Gulf area.
We are matrixed with the 2 clinical services. This is reflecting the true multidisciplinary approach to the patient. We see the patient together and we plan the management together. And this is unique to King Faisal. This is saving time, saving money to patients.
Cardiac cath lab is one of the allied health departments in the hospital who deals with patients who got cardiac problems. We start doing some interventional and diagnostic procedures that really helps to improve and restore the functionality of the heart. One of the roles of cardiac cath lab is to avoid the surgical approach in treating some diseases in a safe, high-tech and timely manner.
Teamwork is essential to the practice of cardiovascular medicine and its subspecialty disciplines. To achieve optimal patient care and satisfaction, there must be collaborative efforts between physicians, nurses, and allied health professionals, where everyone is more effective and patients reap the benefits. The Heart Center allied health professionals include not only cardiovascular technologists, but also radiographers and perfusionists. They provide technical support for our cardiac services, and they are indispensable for the delivery of diagnosis and therapeutic intervention.
The specialists in our hospital play a significant role in patient care. They have gone through extensive background in education ranging 4 to 5 years in theoretical part, as well as 1 year of internship. The internship plays significant role in enhancing the skills of an employee as well as professionals within our healthcare system. We all depend on each other, and therefore they play cornerstone in developing the patient care as a whole.
I would like to take this opportunity to express my thanks and appreciation to all of you, to all our staff in the Allied Health Services. We have about 1,500 staff in King Faisal Specialist Hospital and Research Center in Riyadh. You are playing very important and vital role in the services provided by our institution. We appreciate very much your hard work, your dedication. Without you, we could not provide our services to the expectation of our patient. As you know, Allied Health Services comprise about 60% of the services provided by any health institution. It's not only physicians and nurses, but also the Allied Health and their various departments, whether it is in the laboratory or in the radiology or in anesthesia or nutrition or pharmacy and so on and so forth. So thank you very much for your hard work, your dedication, and we're looking forward to your role, and I hope that you will continue your hard work and dedication in the future to meet our patient expectation, particularly with the expansion, our future expansion of our institution. So thank you very much and wish you a good day.